The stages of pregnancy.
Before watching the video, take a few seconds to subscribe to the channel. We are on all the networks with this name. Atoyles Vagabonds. First trimester. The first trimester is the shortest period of gestation, from when your baby is 2 weeks old until he is 12. During this period, your baby will be growing and his body systems will be preparing for birth. Second trimester. The second trimester is a long period where your baby will be growing at a rapid rate. This is the time of pregnancy when your breasts may be most sensitive to stimulation. This stage ends when your baby is 28 weeks pregnant. Third trimester. In the third trimester, you drink. During the first 12 weeks, the ovaries and tubes produce hormones that stimulate the growth of the uterus. The fetus is also developing and harboring in the uterus. Over the next 12 weeks, your baby is forming at an incredible rate. This stage is commonly known as the highly significant prenatal period. Hormones produce a perfect environment for the reproduction of muscle tissue, and also for the formation of its internal systems, immune, nervous, circulatory. The stages of pregnancy go from the first day a woman finds out she is pregnant until the last day, when she gets to breastfeed your baby. Pregnancy is a wonderful biological process that you must live and enjoy. Like any natural process, pregnancy has its stages, and these are different for men and women. During the first few months of pregnancy, the uterus continues to grow to make room for the baby. Weight increases slightly due to these changes in your body. This stage is perfect for discovering the first symptoms of pregnancy. During this stage, it is very common for you to have discomfort or hidden feelings of anxiety for everything. The gestation of your baby is a very complicated stage, with many fears. Nevertheless, there are some things that you should keep in mind to avoid being strongly affected by worries. Here are the different stages of pregnancy and which are the main worries for each one. According to a study done in the US, around half of pregnant women experience some sort of anxiety during pregnancy. The symptoms can range from mild to severe and can cause anxiety attacks. Understanding the different stages help to understand and cope with the symptoms. Stage 1. When you are pregnant, you may start worrying about childbirth or feel concerned about your baby's health. Stage 2. After your baby is born, this might be when you start feeling any kind of significant anxiety as a new mom, like breastfeeding concerns or child care problems. Stage 3. This is when you have become more confident in your parenting skills and you have dealt with any issues that may have arisen. Stage 4. There are many causes for this, including the changes in hormones in your body after birth, having less support from friends and family members, or even feeling overwhelmed by new responsibilities at work, because all of this can lead to postpartum depression or postpartum psychosis. Los niveles de estrés son normales durante el embarazo, pero si estás experimentando una gran ansiedad ante el hecho de que tu bebé está por llegar, es posible que necesites evaluar para determinar si tienes síntomas de evitación del parto. You should get a physical exam to detect if you have signs of pregnancy-related anxiety. Some signs are nausea, vomiting, excessive tiredness, and headaches. If you have any of these symptoms, it's time to consult with your doctor and take the necessary precautions.
Thanks for watching and sharing this video.
Don't forget to subscribe to the channel. We are Atoyles Vagabonds.